Thank you all for joining us today for our weekly COVID-19 briefing. As always, we're also joined by Dr. Michael Mendoza. I want to start today by reflecting on yesterday's heartbreaking news that our community has surpassed 1,000 COVID-19 deaths. That's 1,000 mothers and fathers, sisters and brothers, aunts, uncles, loved ones, and friends. This has been an incredibly long and hard 11 months since our community's first case of COVID-19, but nothing quite captures the devastation and heartache like the harrowing reality that we've lost 1,000 people right here in our community to this terrible virus. We've all grown accustomed, in some ways almost numb, to the daily data that we receive, the new cases, hospitalizations, positivity rates, but 1,000 deaths is a staggering number, and one that reminds us just how serious this virus can truly be. But it also is a good reminder and a time to reflect that behind all those numbers that we give you are people. Behind those 1,000 people who have died, each one of those thousands is a person who has a family and someone who loved them. And so we need to keep them in our thoughts and prayers, and I ask everyone in our community to reflect on those losses that we've occurred over the last 11 months. As we've talked last week, our numbers, though, are continuing to trend in the right direction. But we also need to remain cautious and vigilant in our efforts. This week, again, I'd like to share a few slides from the Monroe County COVID-19 dashboard to give us all a sense of what we're seeing here in the county. Our 7-day average of new positive cases continues in a downward trend, with yesterday's average at 219. If we compare that to just last week when we updated you, the average then was 315. It's a remarkable continuation of the downward trend over the last 7 days. If we compare that to so what we've seen too then is the steady decline, and this is also our 7-day average is lowest that it's been since November 11th, which is when we reported 218. Yesterday's new case total was 265. Wednesday was 209, and on Tuesday we reported a relatively low 170. So we're clearly heading in the right direction. So we just need to stay on top of where we are and continue, hopefully, to see that downward trend. Our 7-day positivity rate was 2.9% compared to 4.6% when we spoke last week. Again, a remarkable downturn in the positivity rate. The last time we were below 3% was November 5th, which was 3 months ago. Our hospitalization and ICU numbers, which we've said are a lagging indicator, as we know, they also continue to trend downward. As of yesterday, there were 501 people hospitalized in the Finger Lakes region and 119 in the ICU. Comparatively, those numbers were 662 and 134 in the ICU just last week. So that trend is still continuing down at a pretty remarkable pace from 662 last week to 501 today. We're heading in the right direction on a downward curve across the board. And I think this is truly a testament to all of the work, vigilant efforts that our community has undertaken to reduce the spread of COVID-19 in our community. We just need to keep it up. And as we continue to vaccinate more people every week and get us to that point where we can continue on the path that we're on, and we can get through this. There's a light at the end of the tunnel. We just have to get there. We have to get through it, and we are getting there. So thank you to the community for your efforts. We're about a month and a half into the vaccination effort, and in our third week this is our third week utilizing the county-operated vaccination pod at the Rochester Riverside Convention Center. To date, 12,895 people have received their first dose of vaccine, and 1,729 have received their second dose of the vaccine through the Monroe County Department of Public Health and our county vaccination efforts at the County Convention Center and the Fleet Center and 111 West Fall Road, so at the county pod. So those numbers are just the county local health department pod numbers to date, not the full county-wide, everyone in the county or region. As we said before, this is all based on our allocation from the state and a directive from the state that we target vaccinating essential workers eligible in phases 1A and 1B. This, like I said, only represents Monroe County's efforts. Those numbers do not include those being vaccinated through the local health systems, local pharmacies, nursing homes, or other federal programs. Governor Cuomo in New York State have also announced our latest pop-up equity vaccination pod for this Saturday, February 6th at the Rochester Riverside Convention Center. Similar to the pop-up pod that was held at Mount Olivet Baptist Church last week, the county is working with Common Ground Healthcare, the City of Rochester, the Rapid Response Team, our faith community in New York State to reach out to targeted populations, again, as directed by the state, to ensure there's an equitable distribution of the vaccine. As with all of our vaccination efforts, though, remember this is a appointment only. So at all the vaccination pods, whether it's the county health department, the state at the Dome Arena, if it's through the healthcare centers or the local pharmacies, vaccines are made available by appointment only. I also want to address that earlier this week, the state announced the option to expand the eligibility to vaccinate taxi drivers and restaurant workers pending local approval. Dr. Mendoza and I met with our regional counterparts and with the control room yesterday to seek a regional plan to reduce confusion and talk as a region as to where we are in our vaccine distribution. At this point, the challenge that we are faced with is that we simply do not have the supply to meet that demand in the immediate term. And you know, we've talked about this a lot before. Right now, we still have tens of thousands of people just right here in Monroe County who are eligible for a vaccine. The supply just isn't there yet. And so, so once that supply is available, the eligibility what can be expanded and it can be revisited. And, you know, so at this point, what we really need to do is work with everyone and understand the patience that's required when we face a situation where our demand and our capacity to administer vaccine greatly outpaces the supply. And to remind you how that works, the supply comes directly from the federal government and the manufacturers. The federal government has the distribution plan that pushes the vaccines down into the states. Then the states pushes those vaccines down into the localities. In New York State, it's pushed down into the regions through the distribution network. Monroe County receives a weekly allocation through the health department, as do pharmacies in Monroe County, the health departments, and other partners that we use week to week. And we've been doing a good job as a region getting out all of the vaccine that comes here on a week-to-week basis. And we remain hopeful that there's an increase in the supply that comes to us each week. We don't know what that supply is week to week, though. We're generally notified at the very end of the week or over the weekend what that following week's supply will be and what it will look like. So it's very difficult to know into the future what it will be, but we track it week to week and we go through that supply each week. The last thing before I turn over to Dr. Mendoza is a reminder, this Sunday is Super Bowl Sunday. Typically, it's one of the most popular gathering days at this time of the year. You know, while the Bills didn't make it as we all had hoped, I know that a lot of people are still going to watch the game. We just need to remember, as we gather with friends, we gather with families for for the Super Bowl this weekend. We wish it was a Bills game. We need to make sure we're following the guidance. Don't give up on the progress that we have made over the last several months. Wear a mask, continue to be socially distanced, and follow the guidelines that are in place so that we can enjoy the game this weekend, but still get out of this while keeping our numbers in the right direction, heading down. So with that, I'll turn it over to Dr. Mendoza.
Thank you, County Executive Bello. I also want to extend my sympathy to the families of those 1,000 individuals who we have lost here in Monroe County since the beginning of this pandemic. I've had the privilege of caring for many of these families in the hospital in my office, and I can attest to the very, very real difficulty that people have experienced as a result of COVID-19 infection, all of the aftermath from the infection, and all of the healing. I can also say that this in many ways has been a chapter indicative of our greatest strengths. We have come together in ways that we never thought we could, as a community, as neighbors, as churches, as schools, to accomplish what we never thought we could, and that is to flatten the curve again. I say that with some trepidation because as we look at these numbers improving as they are, we also know that we're not out of the woods. There are many uncertainties that lie ahead. We know that the vaccination process is taking longer than we all hoped. But at the end of the day, I think we can all say that now may be a time where we can at least stop and reflect on all of the things that we've accomplished as we come together, looking ahead to what I hope will be a brighter spring and summer and the rest of 2021. The county executive also mentioned the improvement in our numbers. And as we'll report today, the number of cases is 265, which represents a decrease overall when you look at the 7-day average dating back to several weeks now. Our county positivity rate is under 3% for the first time in a long time, 2.94%. And many often ask, well, how did it get to be, quote, so good? First of all, I want to caution that we're not out of the woods. That is still roughly 3%. In other words, in any room of 100 people, on average, there will be 3 people there who may be liable for transmitting this infection to other people. So it's not the time to stop taking our precautions. But at the same time, we were looking at a rate that was almost at 10% not long ago. What I will say is that the holiday surge is behind us. We know that a lot of people gathered during the holidays. We also know that a lot of people took their precautions during the holidays. And I think that is in large measure the reason why we are seeing improvements in these numbers now. People are following the guidance, people are following the recommendations and taking precautions appropriately. I also want to say a few words about testing. We have, as you know, made the statement to the schools that it is reasonable to reopen higher risk sports. We talked at great length last week about all of the concerns that entails, the balance between the benefits of sports participation and extracurricular activities with the known risks of COVID-19 in these closer contact type situations. I've asked the schools to consider if they would like to do voluntary testing, and some have indicated that they would like to do so. I think it's reasonable that we don't have a countywide testing program given that the positivity rate is as low as it is. But I don't think it would be bad to have some information, particularly in the city or in other areas where there remain concerns about reopening and so forth. So that is something that we're looking into. We're evaluating that going into the spring. Given the governor's green light last week that wedding receptions and other types of gatherings will be allowed to open with a larger capacity later in March. We're evaluating our entire testing program as we speak. So we still have the county testing program that is available on our website. Monroe Community College is still conducting their testing program as well. So while we look ahead to vaccination, I also want to make sure that people remember that testing is critical. Testing is especially critical as we look ahead to these variants, these COVID-19 variants that we're now seeing across the globe. We've seen them in South Africa, in the UK, and in Brazil. We do have testing. We are sending specimens locally to Wadsworth Lab, looking for these new variants here in the county. And to date, we have not seen any evidence of these new COVID variants, but we are looking. We have seen them across the state. 44 cases, I believe, of the UK variant have been identified here in the state. And the way we combat this is the way we combat COVID, which is to wear our masks, to keep our 6 feet of distance, and to be thoughtful about our gatherings. So with that, I will take a break and turn it back over to Julie, who will take your questions.
Thank you.